Spotlight us.
Go ahead, Shelly.
Okay. Good evening, friends. Good evening, ladies and gentlemen. And I hope there are lots of gentlemen joining us this evening too. Though the topic may be women oriented, but men are most welcome to listen to what Dr. Shelly is going to share with us today. So welcome to session 73 of our Zoom in series, our virtual get together. Today's session is in partnership with Rose Walk Hospital, a luxury hospital for women. And we are delighted to welcome Dr. Shelly Singh, who is a senior consultant of obstetric and gynecology at Rose Walk. The focus of today's session is women. But gentlemen, please don't leave. This session today will benefit you too. Dear viewers, did you know that women experience many unique healthcare challenges and are more likely to be diagnosed with certain diseases than men? Chronic diseases and conditions such as heart disease, diabetes, endometriosis, uterine fibroids, gynecological cancer, polycystic ovary syndrome, sexually transmitted disease, osteoporosis and bone health, menopause are to name a few. According to the Center of Disease Control and Prevention, which is CDC, cardiovascular disease is the #1 killer of women, causing 1 in 3 women to die each year. I mean, frankly, I did not know about this till I was looking and reading more about this topic. According to CDC, more than 10% of women between the ages of 15 and 44 struggle with pregnancy and getting pregnant. And some of the underlying reasons may be fertility, could be endometriosis, PCOS, but sometimes there is no explanation why this happens. Mental condition is again something which we women are more prone to. Problems like anxiety, depression, bipolar disease affect more women than men. Breast cancer, cervical cancer are more common among women, and no matter the age or the race. Sorry for painting such a gloomy picture. But we are very fortunate to have Dr. Shelly Singh here with us, our guest today, who is well equipped to tell us more about some of these concerns which I have listed out just now. She has over 2 decades of experience in gynecology and obstetrics. Dr. Shelly completed her MBBS from the prestigious MAMC, New Delhi, and is a gold medalist from LHMC, New Delhi. She specializes in high-risk pregnancy care and has dealt with challenging cases with full confidence and successful outcomes. She is involved with teaching, academics, and community care, and has been imparting and training mothers about prenatal care and pregnancy management, along with creating awareness about women's reproductive disorders. She is the recipient of Pratibha Tiwari Gold Medal and APJ Abdul Kalam Appreciation Award in 2018. Currently, Dr. Shelly, as I mentioned above, is a senior consultant with Rose Walk Hospital in New Delhi. Rose Walk is a super specialty birthing hospital situated in the heart of South Delhi at Panchshi, and they have a 35,000 square feet of luxury and medical expertise dedicated to ensuring women's birthing experience remains one of the most cherished memories. A very warm welcome to you, Dr. Shelly. And let's get deep into the session. And let me begin by asking you, being a woman, you know, we are constantly getting on the scale and measuring our weight. Is measuring our weight and measuring our waistline an indicator of being healthy?
Okay, so first of all, thank you so much, Sanjana, for having me here. And that was such a
Our
lovely
pleasure.
introduction. And I am most honored to be here to be able to share some of the insights that you want addressed. So first of all, yes, in a way, yes, waistlines are something which actually indicate a lot of lifestyle disorders. So it's important that we keep our waistlines in check. That's an important thing. And weight also is definitely important because, the fact is that an increased BMI is linked with a lot of disorders, a lot of illnesses, which could be anything like diabetes. There could be other lifestyle disorders like heart disease. There could be hypertension. There could be even things like strokes and all because of the hypertension. Along with that, yes, obesity is also linked with feminine disorders like polycystic ovarian disease. We do have an association even with a difficulty in conceiving. We have problems like gestational diabetes which crop up because of the same obesity. We have hypertension in pregnancy and a host of other disorders which could be present. So much so that even conditions like endometrial cancer are linked to diabetes, obesity, and hypertension. So this is a classic triad which is responsible for endometrial cancer. So, right from the time, and even adolescent polycystic ovarian syndrome. So, right across the board, we have problems which do come up because of obesity and because of, a raised BMI right from adolescence up to menopause.
I was going to come back and ask you a bit more about PCOD later on, but because that is a very important, it's a problem which most of us, I mean, the younger women are facing these days. And it is something which, as mothers and grandmothers, when you see the younger daughters or granddaughters suffering, you feel very helpless. So we'll come back to that, but since for the benefit of the men who are there and who have joined us, thank you for being there with us this evening. um, please tell us a little bit about wellness. What is wellness? Why is there an emphasis on wellness now?
So basically, wellness may have different definitions for different people, but overall, a holistic healthcare approach is what essentially constitutes wellness. So it is not just to do about looking fantastic or feeling fantastic, but also about being absolutely healthy. And healthy means not just physical health, mental, emotional, all that is also included, and that has to begin with a healthy lifestyle as well. So there is a lot which is included in wellness, which comes from the preventive aspects as well as taking care of our lifestyle and making sure that we are the healthiest option, the healthiest options of ourselves. So that basically it would mean healthy lifestyles, and it would mean a lot to do with the preventive aspects of health as well. Eating healthy, exercising, taking care of our weight, and avoiding a lot of other things. So these, maybe we can just focus on that slowly and just take it forward.
um, you mentioned exercising. um, Exercising was meant to be a way of celebrating doing some physical workout, but it has become like a sort of punishment which we make ourselves go through in the hope and the wish that we are doing this to becoming healthy. What's your view on this? Should we exercise to the point where we are exhausted and we can't do anything else, or is that something which is not the right way of approaching exercising?
Yes. So, you know, when you see some of my prescriptions, 99% of them do have the, you know, the triad of exercise, of diet, and of weight check. Now, however, this exercise must not be to the point of exhaustion. The first important thing is that you have to listen to your body. It's good to push yourself to do a little more, but not till the point when you are, you know, when you're getting so exhausted. And we do have, occasionally, we also have people, young people also, who are exercising so much that we've also heard of people, you know, who are just dying like that. So we do have very healthy exercise freaks who are there, who do not know where to limit this exercising. So it's
Mhm.
important that, you know, basically, first of all, one, you always listen to your healthcare professional, in the sense that you must take their permission before you just start exercising. Because I often have people who will say, you know, they've just got over a major surgery and they're saying, can I start doing, you know, high intensity exercise? No, that cannot be done. You have to start very slowly. So first of all, you must have all your medical history charted out, and accordingly you have to choose how much of physical exercise is good for you. So considering everything is fine, it is said that approximately 5 to 6 times in a week you must exercise, if all is good, unless, you know, you've been asked not to exercise for some specific reason. It's important that at least 10,000 steps, as we say, you know, and most of us have heard that. Otherwise, it's around 250 hours of moderate intensity exercise and 150 hours of high intensity exercise. But let's not also go, you know, this is just a typical
Mhm.
objective way of saying it, where let's not actually talk about hours and all. It should basically
Right.
be about 5 to 6 hours of exercise and whatever makes you feel good. So whether
Mhm.
it is a running, whether it is a jogging, whether it is a walking, whether it is a brisk walking, whatever, for whether it is swimming, whether it is aerobics for the younger people, you know, everything, and appropriate to your age as well as your medical conditions, are definitely what are advised.
Um, so is the concept of wellness different for men and women, or can we say that, it's the same?
So essentially, it comes to the same thing. You know, let us not be gender specific there, because
Mhm.
ultimately, you know, we want people who are healthy every which way. So
Right.
holistic health should be there for everybody. And most of the times, you know, again, the concepts remain the same. Whether it
Mhm.
is your exercise, whether it is your diet, maybe, you know, the calorie requirement may be a little more where it comes to the men, you know, given the weight to weight and the same circumstances. But then it's important that everything is approximately the same for them. And even preventive aspects, we may not have the same kind of tests which are required of men and women, but yes, we do need to get these preventive tests done, whether it is for the men or whether it is for the women.
These tests which you talk about, these are the tests which you can gauge the how healthy you are. I mean, if you could tell us more about what are
Yes.
these tests which you're
So,
talking about,
yes.
and how often should one get these
Yes.
tests done?
So, you know, the preventive health checks are available at most of the hospitals, as you
Right.
do,
Mm-hmm.
and they are all age appropriate as well. So, if I actually have to talk about women's health, then it's very important that there are some basic tests which need to be run. So, these could be just your normal routine blood work. Along
Mm-hmm.
with that, you know, these days it's going to be the month of even cancer awareness next month. So it's
Mm-hmm.
important that we should, at least from the gynae point of view, you must have at least a breast examination done, even if you're in your 20s. Breast examination means an examination which could be a self-examination, which should be taught to every girl. And along with that, you must go and visit a doctor at least once a year, where at least they do a palpation of the breast tissue. And along with that, an ultrasound of the breast is what is indicated. If you're post 40, a mammography is what is required, because that's a specialized x-ray of the breast tissue, which gives us a lot of information, and it even picks up the smallest of cancerous lesions in the breast. Now, where we come to an examination, a pelvic examination should also be done once a year, by which I mean that it's a physical examination that your doctor does. We have to get a pap smear done, and sometimes that can be even clubbed with a human papilloma virus study. So a pap smear is something which should be started at the age of 25, and it should continue till 65 years of age, considering that if all your previous pap smears have been normal. And earlier we used to say that it has to be an annual pap smear, but nowadays we say that once every 3 years is adequate. And if you have clubbed it with a human papilloma virus study, which most of the good hospitals are doing, then it's required once every 5 years. So, it's not that tedious process where you have to go to a doctor, because most people are still very scared of coming to a gynecologist and getting an
That's right.
examination done.
Mm.
So this is what would be required, and a basic ultrasound examination. These are some of the things which are definitely required from the gynae point of view. And in the menopause, of course, we also want that for postmenopausal patients, we should also have a bone densitometry, which is also carried out. So these are some of the basic preventive health checks, which are even going to prevent very ominous diseases like, all these cancers. I would like to talk about the cervical cancer, and it is one of the preventable cancers. It's the second most common cancer in Indian women, and it is absolutely preventable, because here is a cancer where we know what the etiological or the causative agent it is. It's a human papilloma virus, and this actually is a very common virus which infects us, once sexual activity starts. Most of the times the body is able to clear it off, but 10% it may just continue. It may first cause precancerous changes in the cervix, and then it may become cancerous, and this takes around 10 to 15 years. So if we've been screening ourselves regularly, and if we have been getting our pap smear as well as the human papilloma virus screening done, it's a very good method to even detect precancerous changes, which are very, very easy to treat. So, you see the importance of preventive health checks. I've often come across, very socioeconomically very well-to-do people also, who have not ever got something like a pap smear done, or have not even got a mammography done. So I
Right.
believe that it's the education which is most important, and once we start doing that, it's a good way to actually prevent some of the very ominous you know
List
disorders
of
and
list of problems which I have just
yes,
highlighted. I mean,
absolutely, absolutely.
I was like shocked. My jaw was dropping, like
Yes,
because one never actually thinks these are the problems which only
absolutely.
women may end up facing. So yeah, that is there.
Yes.
Um, so how often, I mean, the blood test which you were talking about, you mean you spoke about having these tests. How often should the blood tests be done,
I believe
preventative
that,
blood?
most times you can just get them done once a year. I think
Once a year?
an annual health check is quite enough. However, if there is a problem, and if it is suggested that you get more frequent tests done, just talk it out with your doctor, or with your physician, whoever
Mhm.
is looking after you. And if required, it can even be done at a shorter frequency.
Okay. Um, we have, I mean, coming to food and problems related with that. Last week we had a session uh, about the importance of food and eating the right type of food. We have so many variety of food and food from all over the world, which is available now on your fingertips. But yet there is a increase in eating disorders. There is an increase in, anemia. There is an increase in people, you know, having eating problems. Why do you think that is the case?
Yeah, so there are a variety of diets which are available. There are a variety of food items which are available, but I somehow feel that we've gone away from our basics, where we used to eat home cooked healthy food, and we used to eat less of junk food. Now, what to say of anybody else. I have my own children who are ordering all the time. You have Swiggy and Zomato coming in, and
That's
we
true.
all know what kind of food that is.
Yes.
So it's important that most of the times we eat healthy, which means that whatever be your kind of diet that you are following, or whatever kind of healthy eating that you're following, I believe that small frequent meals with small portion size, with a healthy balanced food. And we often say these days that you should, on your plate, it should be like a rainbow color. That's supposedly the best way of eating. You have lots of green vegetables. Make sure you have your colored fruits and vegetables there. Make sure you have your sprouts, your proteins, and along with that, the dairy products, and make sure that you're eating healthy, avoiding junk as much as possible, avoiding packaged food as much as possible, processed food as much as possible. And apart from that, a lot of foods are just empty calories. So there's hardly any nutrition, but then, because it's tasty, we are just eating that. So we
Mhm.
need to have a kind of a balanced diet, a rainbow color of things on your plate, and make sure that the portion size is also just adequate. We don't want to, thinking we are eating very healthy, we don't want to add 10 uh, huge portion sizes, or maybe just a salad and all. So portion size as well as the food has to be right. That's very important. Foods which have a low glycemic index, which means that the sugar does not shoot up immediately. So all those things really matter where it actually comes to maintaining good nutrition as well as maintaining your weight.
Um, you talk about, eating small, frequent meals. Many people these days are doing intermittent fasting, and you're fasting for extended period of time. Um, is that something which is good for the body, or is that something which will cause problems
So
going
yeah, so currently, yes,
forward?
a lot of people do have it's there is a scientific basis to the intermittent fasting also. And if you don't carry it to the other extreme, that you're barely eating anything and you're doing your intermittent fasting, then you're losing huge amounts of weight and not being able to maintain it. That is also not right. So I
Mhm.
do believe that whatever form you do of diet that you do follow, make sure it is sustainable, not that you're doing it one day and then you cannot manage it for the next few days or so. So it should be something which is sustainable, which you can do easily, and which basically means that it's a balanced kind of a diet which is there. Intermittent fasting, yes, these days currently a lot of people are doing and losing a lot of weight with it. And currently, there is no contraindication as such to it, so I won't be able to say that it should not be done.
Okay. Um, what is your view on having immunity boosters? Because that's again something which is very, very common, and we often just take multivitamins thinking that's going to make us healthy.
Yes. So, multivitamins also, I do remember that even in our, when we were very young children, we were told, okay, you need to have all these vitamins. You may not even need them, because
Mhm.
most of the vitamins are sometimes the water soluble vitamins, like some of the vitamins like BC, etc., are water soluble vitamins. So your body will just imbibe those, and it will take care, it will just excrete out what is not required. But
Mhm.
yes, some of the vitamins, like the vitamin D, is gaining a lot of importance these days, because it is believed to have multiple roles even as an immune booster. But I
Mm,
would like to say once more that, we also need to be careful about how much vitamin D we are eating. Also, we don't want to have hypervitaminosis, because there is something which is known as vitamin D toxicity also. So just
mm,
make sure that you get, it tested as well, and you are having it for definite intervals of time, like an 8 weeks probably, and then
mm.
on a monthly basis, and getting yourself regularly tested to make sure that you're not going, on the other side of the spectrum. Too much vitamin D is also not good for the body. So a lot of these things, like a vitamin C, a vitamin D, all these things, especially during COVID times, have gained a lot of importance. And there are scientific studies to show that these are immune boosters. Plus, we have some of the food items which are, the antioxidants. So they are laden in antioxidants. Like,
Mm.
we have the green vegetables, we have the broccoli, we have cabbage, we have our lettuce and other things. Also, all these, as well as some of the fruits that are there. So all these are also laden with antioxidants. So it's a good idea to be taking those. And again, like I said, that it's always good to draw a balance and to have, small frequent portions of the same, rather than a lot of fried spicy food, processed food, all of that. Yes, these food items are immunomodulators as well.
Um, let's talk a little bit about PCOD. Um, because I mean, I've read that, and I don't know if that is true, but there are certain food habits which increases the chances of PCOS. So, is that actually true, or is that just something which one reads and then is not actually the correct way of dealing with a complex problem like PCOS?
PCOS is definitely, it's we are calling it the metabolic epidemic syndrome. So it's actually
Metabolic.
gone to, it's gone to epidemic proportions. So if you see about 100 girls, at least 10 will come to the OPD who have this problem. And
Mm-hmm.
it's multifactorial, which means that some of the genetic factors play a role. And along with that, it is the lifestyle which is playing a role. Leading sedentary lives. We used to be very active earlier,
Mm-hmm.
eating a lot of junk food, eating a lot of food which is processed, and along with that, obesity is on the rise. So these are some of the classical features which are causing PCOS. We are seeing PCOS in the lean and thin patients also these days. So there we believe that, it is probably some genetic factor, as well as some of the factors which are other than just the obesity, which is affecting, these girls and causing PCOS to happen. So PCOS basically is a condition. We think it is only in the adolescent or in the young population, but no, it is affecting people of our age, as well as in the menopause also. It has some ramifications, because in the younger age group, as well as in the reproductive age group with PCOS, we have problems like menstrual problems, we have problems of weight gain, we have problems, which have a lot of psychological stress on young children. Like, you can have a lot of acne, which is very stressful to kids. You can have a lot of hair growth, which can be unnatural kind of hair growth, like,
Mm-hmm.
something which is facial hair. There is
Right.
a mixed pattern of baldness which can also be there. Then along with that, you also have some of these features which come up on the ultrasound. And what is happening also is that once you want, because of the menstrual irregularity, the weight gain and all, that's one of the reasons why, they come and see us. Some of the other reasons are because of these hormonal changes. There will be infertility that also happens, and we do require to give medication to control this infertility issue as well. And later on, we do have even the problem of insulin resistance, which is leading to diabetes, which is leading to hypertension, which is leading to heart disease, which is also leading to a lot of depression amongst people of PCOS. And along with that, in the older age group, because all their lives there has been unopposed estrogen, which is responsible for endometrial or uterine cancers. Sometimes people who have PCOS, can even have endometrial cancers. So, contrary to the belief that it is just in the young people that this problem remains, it is actually, across the board that women have problems of PCOS. And Sanjana, what is interesting is that it's the first line of treatment for polycystic ovarian syndrome is just lifestyle modification. So what we've just been talking about, the exercise, the diet, the weight check, that's the first line of treatment. Even
Mhm.
if we lose about 5 to 10% of our current weight, a lot of problem, approximately 50% of the problem does get sorted out. So the first line of management is this lifestyle modification. And yes, then we do have medication to take care of various aspects, depending upon whether you just want your periods to be, corrected, or whether you want fertility to happen, or whether you want, things like diabetes to be controlled. All those, then there are different medications which are available. But again, here comes the concept of wellness, maintaining an ideal weight, taking care of your diet, exercising, which will even prevent this PCOS.
And what is the genetic factor for PCOS?
So
Is there
most
a
of most of the times it's mothers and sisters who do have had this problem, and that's why it happens. So there is no specific gene which has been delineated, but yes, there is a role of the microbiome. There's a role of the of mothers and sisters and other people who also had it. So earlier we never really knew so much about it, but then it's coupled with all these, with the current lifestyle that we are leading, that it's actually gone to epidemic proportions.
yeah, I mean it's a very, very common problem.
Very common problem.
Um, and I mean, I'm surprised that the awareness for you know problems like this is not as much as one would have expected, because so many young children are getting affected by this. Uh, a similar, I mean, a question which has also come up, and I was going to ask you to tell us more about it, is uterine fibroids. And so this is a question from Pragya. Can we discuss uterine fibroids and surgery options? When is the time to get operated? Does the uterus need to be removed, or fibroids can be removed without the organs?
All right. So, uterine fibroids are actually, they are benign growths which are present in the muscle layer of the uterus. So there are different kinds of fibroids. There are different sizes of fibroids that are there, and they may either come up with symptoms or you may not have any symptoms at all. And the important thing is that they are there in the reproductive age group. And later on, when menopause sets in, most of these fibroids do shrink in size. So, if your fibroids are causing symptoms, like for instance, they are causing menstrual problems, you're having very heavy periods, or you're having irregular kind of periods, which can happen with some particular kind of fibroids, or there is a fertility issue, which means that sometimes these fibroids are blocking the entrance of the tubes, and because of that, you're not being able to conceive. Sometimes you may even find that if there are large fibroids, then they may be compressing on the uterus, on the urinary bladder or on the rectum, causing difficulty or retention of urine. And also sometimes they have problems like, constipation and other issues, which can also be there because of very large fibroids. If the uterus is also hugely large, if it's really huge, then it causes problems like a chronic kind of a pelvic pain that is also happening. So it's a dragging pain which is always happening. So these are some of the reasons when we require to do, to take cognizance of this and to treat it. Most of the times, fibroids do not turn malignant. And some of the reasons why we need to operate are what I have just told you. The
Mhm.
options which are available for fibroid management can be either nothing at all, because if it's asymptomatic, it's not causing any problems, they are not very large, don't do anything. When we come to menopause, they will shrink on their own and not cause any problems. However, you must keep on getting your, like I said, annual checkups definitely done, just to see there should not be some ominous increase in the size or some other problem. The second thing which is important is that in case it's causing any problem, we have the option of both medical treatment as well as we have the option of surgery. So medical treatment most of the times really does not work, because most of the times it comes back. But
Mm-hmm.
surgical options that are available are, either we, if it's a young patient who needs to preserve her uterus, or somebody who is maybe a little older, still wants to preserve her uterus. In that case, we have the option of something called a myomectomy, where we just shell out these fibroids and we remove it with the help of either, these days we most of the times we able to manage it with laparoscopy only. So that means minimal invasive surgery for the same.
Mm.
However, if you have completed your family, you are more than 45 years of age, you are having very severe problems, because these fibroids can come again and again. Therefore, it is better to just remove the uterus only. But of course, you need to discuss it. You need to see your options. You need to even, discuss it with your doctor whether you actually want to remove it or not, and whether why your reasons for not wanting to get your uterus removed. So a lot of times these days we are talking of uterus preserving surgery also, because
Mm-hmm.
if you keep on menstruating also, there are some benefits. Only thing is that we don't want these fibroids to come back again and again. So discuss the option. Younger patient, yes, these fibroids can just be removed, but we preserve the uterus. Relatively older patient, we can even do a hysterectomy or removal of the uterus. And most times we do not need to remove the ovaries. If the ovaries are fine, we don't need to remove the ovaries, because these are the organs which are going to produce your hormones. So you won't have an abrupt kind of surgical menopause. That means you will not be, suddenly inundated with problems like hot flashes and, your skin looking bad and all that. Because surgical menopause is an abrupt menopause. It's not like the gradual menopause which happens
Mm-hmm.
when it's a natural menopause. So where we can, we try and preserve the ovaries. But suppose it's a post-menopausal patient and we suddenly find that these fibroids have increased in size, then we definitely need to rule out even a malignancy in these fibroids, and then it's a better idea to get rid of the ovaries also, which anyways are non-functional at this time. So this option is there, and there is also an option which is called a uterine artery embolization, which means that small pellets are placed inside the arteries which supply the uterus, so that these fibroids ultimately shrink in size. So we have medical options, we have surgical options, we have minimal invasive surgery, we have open surgery, and we also have this uterine artery embolization.
So, if you remove the fibroids, there are chances that they may come back.
Absolutely, because it's the unopposed estrogen which is causing these
Right.
fibroids to happen, and we cannot just stop the estrogen production. And people who
Right.
are actually liable to have these fibroids will continue to have them. So, you may find that they come back again. But
Mm.
that's important that, suppose now we have a young patient who's not being able to conceive, she wants to conceive. So in that case, we'll just remove the fibroid, and we will not take, we will not touch the uterus at all, so that there is no difficulty in conceiving. There we do not want to do anything like a hysterectomy at all. So everything has to be individualized according to if the history as well as every case scenario.
Right. You touched upon menopause. Again, that is, it's such a huge, big subject
Yes.
for discussion, and all of us, all women go through it, but so very little is actually understood about menopause.
Yes.
I mean, we are getting a little bit more information now. How can one look after oneself during this process? I mean, this whole, menopause stage of women health. I mean, women's life, really.
Yes. So, in fact, menopause is something which is gaining more importance now. In our grandmother's times and all, they used to have problems, but then, I think they were just not addressed really. Or maybe,
Mm.
they were so tolerant towards it that they actually they did not have a problem. Now I don't know what it was, but nowadays, there are so many issues which do come up. First of all, it is our what should I say, it's our attitude towards the menopause which affects a lot of things. If you know that it is a part and parcel of the aging process, and it is going to happen, maybe one is a little more prepared for it, but actually one is never prepared for it. So you may have problems right from things like anxiety. You may have depression. You may have irritability which suddenly increases. You can have problems like hot flashes which come, which is a very common problem, especially in the head and neck area. Suddenly you're in a room where the AC is on, and then you have this increased sweating that is happening, and it's a very uncomfortable feeling. Along with that, there is problem with your hair, there is problem with your skin. The vaginal dryness is there, so intercourse becomes very painful and it becomes difficult, and that's why a lot of people are not even able to lead physically active lifestyles. So that is something which also happens. Urinary tract infections are more common because the lining of the urinary bladder, the lining of the vagina does become quite dry. So infections also are quite common. Vaginal dryness will be there. Plus, along with that, menopause is also associated with some of these problems like heart disease, because estrogen in certain quantities is required. And once we are a little depleted in our hormones, heart disease can also happen. Osteoporosis or thin bones can also happen. So all these are the problems which do come up with menopause. So how we can take care of, and weight gain, of course, suddenly we find that midriff that you talked about, suddenly you find that you're just not able to manage that weight, and it would probably take you a month or so of rigorous exercise previously, and you were able to manage that weight, and now you just cannot do that. So there are all these problems which are there. So I do believe that some of these things, of course, would be to first of all to accept that, first of all, and secondly, then we do require some basic supplements, like we do require our calcium. We do require sometimes things like a primrose oil or a vitamin E also takes care of the hair and the skin and other things. Then we also sometimes do require things like an Avalon cream or a estrogen cream in case you are having very dry, if the vagina is extremely dry. Or you also have options like a Vaseline cream and other things which can be there. Plus, we have the hormone replacement therapy. Earlier, it had gone into disrepute because there were too many studies saying that it was linked with the cancers. But then in recent studies, it's been found that in the dosages which we are using and in carefully selected patients, that means we have to rule out any problem, if there we don't want to give it to every woman. But if you have a carefully selected patient in which you probably will not have a problem with this estrogen and progesterone, the hormone replacement therapy also suddenly changes your lifestyle, and it changes everything, and things are definitely much better with that. There are some non-hormonal options also which are available. So there are a lot of things which can be done. Along with that, of course, it is the exercise, then it is also the support therapy which is there. So many things which are available, which
Mhm.
we should know where to seek.
So it is good to have these multivitamins, as you suggested, calcium, primrose oil,
Yes.
vitamin E, and have that for extended period of time, or just have it for 3 months top.
So
and
I
then consume after a gap, or
take it for some time, then leave it for some time, and then depending upon your own scenario. Like for instance, if you're a little prone to have kidney stones and all, we would say that don't have it so often. And your calcium, your vitamin D, or there are other multivitamins that you need to take. All those will be taken, and just give small breaks in between wherever possible. And like I said, that even for menopause, most hospitals do have a good system whereby you have a health check system also. So I believe, even if you've not got anything done previously during this age, you must get your preventive health checks done.
okay, I think that's a very, very important takeaway from the talk today, that we all have to, as women, especially if you're in the post menopausal, stages, that do get health checkup done. Um, Jumping to the opposite, contraception. Again, that is a topic which is, we don't talk too much about, but yet it is a very important, topic. Is it, I mean, there are so many various options of contraception. Which, according to you, is something is, I mean, that we should opt for?
So Sanjana, again, there is not one thing which fits all.
That is true. That is so true.
Forms of contraception which are available even in India now, and it depends upon, first of all, what kind of person you are, because a lot of times you have a person who is very, very organized, regular, doesn't forget things. So you have options which are available for them. Contraceptive methods which you need to use every time, or which you need to take every day. So it could be some of the hormonal pills which we need to take every day, that also you must not forget to take them. But suppose we have someone who's a very, very busy person, forgetful, doesn't remember. We want something which is, something which is a less fussy kind of a thing, and which is low maintenance. So we have things which are available in the form of intrauterine contraceptive devices like our copper teas. We have the intrauterine devices or intrauterine systems which even contain the progesterone. So one of the things which can even be used for things like endometriosis and even for fibroids, unless they are impinging on the cavity, is something called the Mirena, which is a progesterone containing intrauterine contraceptive device. Then apart from that, we have the implants. So the implants can be just put beneath the skin of the arm, and those also can be just left for about 3 years or so. Then it depends upon whether you are okay with having some vaginal methods of contraception, whether there is any reason why you should not be given the hormonal contraceptives. For instance, in case you have, if you're a very heavy smoker, you're more than 35 years of age, you have migraines, you have a family history of, thromboembolism, you have history of clots, heart disease. So in these people, we don't want to give estrogen containing hormones. And in that case, we can always give even progesterone containing ones. And we do have the other options like condoms, and we have the option of cervical caps and diaphragms also, which are available. So there are numerous options. In case you're breastfeeding your little one, you don't want to give them, oral contraceptive pills which contain both estrogen and progesterone. So we have options for them like the progesterone only pill. We have options like the progesterone containing implants, devices, so for everything we have some option which is available. And the thing is that depending upon what you really want, what
Mhm.
your objectives are, what your history is like, and if you have associated problems also, your doctor will be able to figure out something for you. And
Mhm.
sometimes it also happens is, that if you have adopted some kind of contraceptive method, you may find it's not working for you. So you needn't feel distressed because of that, because there are other ways which are also available. So there is a whole lot of things that are available. And like we always say, prevention is always better than cure. Rather than have messy abortions and all, It's
Mm,
much better to use
mm,
contraceptive methods. And there's something I would like to again say, that these days people believe that emergency contraceptive like the eye pill is the magic thing, and you just pop one thing. That I'm finding a lot of girls, एक cycle में they are having at least 4 or 5 eye pills, which is really very bad, because the eye pill is not a regular method of contraception. That is only to be used if our regular method of contraception fails sometimes. Suppose you have a condom which has broken or which has slipped, or sometimes there is some unprotected intercourse, or if you've forgotten to take your pill, only then you should use this. Eye pill should not be used otherwise, because if it fails, there are even things like life threatening ectopic or tubal pregnancies which can happen with that. So I always say that in every forum,
mhm.
that eye pill is something, you just go to the chemist, they'll give it to you. It should not be taken like this, and it should not be popped. Everything will be taken care of.
Right. And are there any long-term impacts of being on contraception of any sort?
Well, not much, because so many people, even for 5 or 6 years, have been taking these contraceptives. But like I told you, it's important that we keep screening for any problem that can happen, because there is, some people are a little more prone to breast cancer, to cervical cancers, and these can happen. They can just be exacerbated with these forms of contraception. Therefore, you must, first of all, get yourself checked and see if you are an appropriate candidate for that. And secondly, even if you are on it, get yourself checked regularly. Like a pap smear should be done regularly, a mammography should be done regularly, because those are things which are going to pick up the slightest problem. Even if you are using contraceptives, but for very long, obviously, we don't want that you just indefinitely keep on continuing this.
Right. So, I mean, again, it's very important to have checkups done frequently, and especially if you're using any form of contraception, then again, it's quite important to regularly ensure that everything is working all right. Um, Women hygiene, again, something which we don't talk very often about. Why is hygiene so important?
So, there is this, we have our organ, which is the vagina, which is actually a self cleansing organ. It has
Mhm.
a lot of bacteria which are there. It has an acidic medium which is there, which takes care of a lot of infections. So, by itself, it's able to clear off a lot of problems. But in case we don't take care of our hygiene, there are many infections which can happen, which could be like sexually transmitted diseases, other infections, and occasionally urinary tract infections. Sometimes those are also very, very irritating. Occasionally, because of these sexually transmitted diseases, you can have the tubes which can get blocked, and there will be problems of fertility also, which can happen in case there is infections which are related to pelvic inflammatory disease. So it's important that we maintain hygiene. That's extremely important, which means that first of all, we need to keep the area clean. Every time we go to the washroom, we must make sure that we just washing ourselves with just plain water. We do not need to use any fancy feminine hygiene products. Also, that's what I tell most of my patients, because it's not required. An important thing is wearing cotton undergarments, keeping the hair clipped short, or some form of hygiene which is maintained there. Make sure that you're not using the jet inside the vagina. That's another common mistake that people make. They'll say that मैं तो सारा time I use Savlon, or I use Dettol, I'm using that water, I'm using the jet inside. That's not to be done, because the normal healthy bacteria in the vagina will be washed away, and you will have abnormal ones which will come and take their place. So that's important. And along with that, using, if you needed to use dirty public toilets, a lot of infections come up with that as well. So it's very important that we take care of feminine hygiene, and especially hygiene also at the time of the menstrual cycle. So menstrual hygiene products should be definitely taken care of, and make sure that you're using, if you're using pads, they're changed frequently. If you're using tampons, those are changed. These days there are a lot of girls who are switching to menstrual cups also. So we have a younger generation who believes that, it's important to be ecologically friendly, and it's important to
Mhm.
have a form of sustainable hygiene. So that's also there, but we have to make sure that those are changed very frequently.
Um, Something which you mentioned in course of talking about both PCOS as well as menopause is depression, something which women are, especially young women, are more prone to. Why is that the case?
So basically, I would still say that, it is gender non-specific these days.
Okay,
So as
right.
women, I do believe are a little more, sort of the our EQ is a little higher, and I feel that that is the
Right.
reason why it also happens. Sometimes it's to do with the hormones as well, because we have the premenstrual hormones which are also playing havoc. So because of that, there's a little bit of depression which happens at that time. During pregnancy, again, it's a time where you do have all these emotional upheavals that are happening, and that can happen. The postpartum blues and postpartum depression also are happening, again, because of the hormones which are causing this problem. During menopause also we do have this problem. So mostly it is to do with not just our hormones, plus it's the it's our phenotype, the world around us also, where
Mhm.
so many times we are the primary caregivers to our entire family. A lot of
That's
times
true.
is you're getting tense about everything. So that
Mhm.
coupled with the hormones, which does make a difference.
So it's gender neutral and not gender specific.
I do think so. I do think
Okay.
so.
Um, COVID, we've we're all going through this period of uncertainty and anxiety, and many people have had COVID and have recovered from it. Yet there are long COVID, a term called long COVID, where there are lots of problems which are cropping up post recovery. Can you shed some light on that, please?
Yeah. So, most of us have had COVID, and, as in my case also, I do feel I've become
Mhm.
so forgetful, and I am not even
Okay.
remembering names. And also, there's something which is brain fogging, which happens. It's affecting people's memory, starting from top to bottom. Then there are sometimes, there is a problem of respiratory difficulties. We are having people who are having even coughing which is quite prolonged. We are having people who are needing to grapple with the dreaded mucormycosis also. We are having people who are these days coming up with some eye problems as well. Apart from that, we are having people who are having you know uh, the digestive problems, heart disease, in the sense that so many times we're coming across people who are having palpitations, and also sometimes there's a very low heart rate also which is happening for some people. We are having people who are coming with increased strokes. We are having people who are coming with clots which are forming in the legs. We are having people who are coming with a lot of weakness. They're not able to even do their regular activities, muscle pains, weakness. Women are also coming up with problems like, although the authorities deny this, but there are women across the world who are actually even reporting problems like menstrual issues. They're having more bleeding compared to normal, or they're having lesser cycles compared to normal, or even in pregnancy we are having people who are who are not being able to get up from bed. So these are all some of the problems which we are encountering. And as the days go by, we are learning of new and new symptoms which we are now attributing to COVID. So, there's not a system which this COVID has actually left sort of left without repercussions. So there are people, and of course, the mental health also, which is getting affected. Again, that's one of the things which is coming about because of this.
I know. I mean, COVID is really affecting each and everyone. And also one is hesitant about visiting hospitals, and that is also causing, so many ailments to go, untreated and undiagnosed, because people have that apprehension of visiting hospitals.
But
Um,
it's important that, at times like this, when the number of cases are less, I think that one must go and get their regular checkups done. Because, like, for instance, our hospital also is COVID free. So we
right.
very strict protocols which we follow so that we don't have this. And because of this, like, our hospital is one of the COVID free hospitals. Most big hospitals do have COVID wards and all, but you must come in, at least meet with your regular physician and all, because we never knows when again we may have a higher number of cases, and again, for 1.5 2 hours one is left behind, and things which are already there just keep on festering and they can just get very complicated.
Right. So for viewers, I just want to just read out about Rosewalk Hospital, which is a super specialty birthing hospital, and it is situated in Panchsheel in South Delhi. And apart from being a regular hospital, it also specializes in all medical procedures around childbirth, and it has a maternity clinic as well. So uh, thank you, Dr. Shelly, for being part of our Zoom in this evening and telling us, actually addressing so many of these very important questions, which often one kind of don't talk about. And, we tend to just ignore, and in the hope that things will get better. There are one or two questions here in the chat box. Let me just read that out to you. Can a blood test CA markers indicate the presence of cancer in the body?
Yes, so there are some kinds of cancers which correlate well with some of the cancers. So, like, we have some tumor markers which are there, and there are different tumor markers. Like gynae tumor markers could be like a CA125. There are other markers like an alpha beta protein, beta HCG, CEA. These are there for ovarian malignancies, and there are, in the same way, there are some tumor markers which are available for other kinds of cancers also. So they are blood markers which do indicate the presence of cancer. But what the way we go forward is that, once you get the ultrasound done, in case there is any problem which is there, then you must get this test done. And thereafter, in case that is also high, then we need to actually evaluate and see what the problem is. And most hospitals like do also have a CA125 which can be done as part of the regular screening in the preventive health checkup.
Thank you for that, Doctor. Thank you for an excellent session, very informative. This is from Padmini Mathur. And Pragya, who asked the question about uterine fibroids, written, exactly, surgical menopause caused my mother a lot of issues, hence my reservation. Okay, thank you very much. This is another question. What is the cause of repeated UTI infection?
Urinary tract infections, did I get that right?
Yes.
Yeah.
Yes, UTI.
Urinary tract infections sometimes can happen, because our immunity is low. That's one thing. The second
Mhm.
thing is that, in case there are repeated vaginal infections, because it's a very close organ to the vagina. In case there is diabetes, that is again one of the reasons where your sugars are deranged. It can happen then. And although, most of the studies will not say that it is because of using public toilets, but we do notice that every time if you're using dirty public toilets, it does happen. And because, sometimes what happens is that repeated urinary tract infections can happen in case, you have this kind of symptom, immediately you pop your antibiotics. So it's causing a lot of antibiotic resistance also. The
Mhm.
correct way is that you must first of all prove that you have a urinary tract and then treat it rather than just popping those pills and having antibiotic resistance.
Okay. I hope that answers your question. Are there any other questions? Anybody would like to ask any questions? I think most of you've spoken about everything and anything which a person could think about. So maybe the one last thing is,
About
about
everything. It was
meditation.
very well researched. There was a question about everything, starting from the youngsters right up to menopause. So I had no option but to talk about it all, Sanjana.
Thank you. Another one thing which we didn't talk about is the role of meditation in, in wellness and in being healthy and especially calming oneself down. So,
Very
what's
important.
your view on that?
Yes, I do believe that meditation is very important. In fact, along with whatever form of intensive physical exercise that we are doing, I do believe that yoga and meditation really play an important role in, in every walk of life. It's very important.
Um, Thank you for reaffirming that, because that is something which, we need to hear more and more, because we do need to make that a part and parcel of our lives, which sometimes we do, and sometimes, one is too busy and one tends to forget and ignore it. But thank you so much for taking the time out, Dr. Shelly, and educating us. I mean, we can see that you are an educator and academic at heart. So thank you for educating us about all these different things, and we do hope that we have you back again, and maybe the audience may have specific questions, and we would request you to come and be part of Zoom in again. um,
We really
I would
have.
like to thank the viewers and uh, thank our colleague and the host, Mr. Sharma, for being part of emphasis on women, health, hygiene, and well-being section. So 3 cheers for you, Raj, for being there. And I hope you benefited as well, as
You
did
know,
so
I
many
must
others.
confess that my interest in the subject was mainly because of some issues that my daughter had faced. You know about that, Sanjana.
Hmm,
So I was taking interest in that subject more from her wellness point of view.
absolutely. I mean, like I said, in the family, somebody or the other may have a problem, and then when you know something about it is always helpful, and it sometimes just gives you peace of mind, because you know a little bit about it and understand it. Thank you, Dr. Shelley, and thank you, viewers, and we look forward to seeing you next week on Zoom in. We are going to be discussing an interesting book, which again can be a women-centric book, but I hope we have men joining in. It's called Valmiki's Women, and it's
Yeah,
five tales from the
it's written
Ramayana.
by by a man.
It's written by a man who.
Valmiki was also a man, and this book is also by a man. So yes,
Yes,
I
it
hope
is.
men will join.
It is a book by a man as well, and he is the writer of the epic Bahubali. His name is Anand Neelkantan. So look forward to seeing you again. Thank you,
Thank
Dr. Shelley. Thank
Thank you,
you,
Dr.
Rosewalk,
Shelley.
Thank you.
Rosewalk
Thank
Thank
you.
you,
Hospital,
Dr.
for
Shelly.
Good night.
organizing this in partnership with the Vasant Vihar Club. Thank you
you.
very much. Take care. Bye bye.
Good
Thank
night.
you. Goodbye, everyone.